afternoon. Good afternoon, Mr. JK. My name is Ellen, and I'll be your nurse educator today.
Hi, just call me Jay.
Okay, so can you tell me what brings you in today, Jay?
Well, my doctor tells me I need to take Prozac because of my depression. I've been seeing a psychologist. Isn't that enough?
Well, actually, so combining psychotherapy and medication has proven to be more effective than psychotherapy or medications alone.
Oh, okay. So why did she pick Prozac? Won't Prozac affect my libido?
Well, yes, Prozac does have some side effects, but Prozac actually belongs to a group of medications called selective serotonin reuptake inhibitors, which you might hear referred to as SSRIs.
Okay.
These medications work by increasing the activity of serotonin in the brain. And doctors often start by prescribing one of these drugs. They are safer and generally cause fewer side effects than other types of antidepressants.
Okay. What are some of these side effects?
Well, some of the side effects include nausea, headache, nervousness, insomnia, anxiety, increased sweating, diarrhea, and some people do experience decreased libido, impotence, delayed or absent ejaculation when taking Prozac. So if this happens, we will absolutely work with you to find a solution.
Oh, goodness. I certainly hope so.
Yes. So while taking Prozac, it's important to call your doctor if your depression worsens or if you have an increase of thoughts about suicide or dying. Okay? Do not suddenly stop taking this medication without first checking with your doctor.
Okay.
Okay? And call your doctor right away if you develop a rash or hives, experience swelling of the face, or have trouble breathing.
Wow, that's an awful lot to remember.
Yes.
What if I can't handle these side effects?
Well, for some people, the first antidepressant tried relieves depression symptoms and has tolerable side effects. For others, however, finding the right medication takes trial and error. So it could actually take up to a couple months to find the right dose and the right medication for you.
Oh, well, my wife was surfing the web and she read something about needing to take a genetic test before taking Prozac. Do you know anything about this test? And would the test help me find the right medication?
Yes, so there are actually genetic tests available for testing the cytochrome P450, and these are enzymes in your body that help process medications. So our bodies contain numerous P450 enzymes to process medications, including Prozac. So basically, inherited traits cause variations in these enzymes. So people may process medications quickly before it has a chance to do its job, while others may process medications a little bit more slowly. So if you process a certain medication more slowly than normal, the medication can build up in your system. This can increase the likelihood that it will cause side effects. But you may still be able to benefit from the medication, but we will just have to figure out the right dosage. We might have to higher or lower the dosage based on how you metabolize it.
Oh, okay. Are there any reasons I shouldn't take this test?
Well, actually, so these tests are available, but they do have limitations. So the CYP testing can't predict which medication will work best for you. It can only provide certain clues. So these tests look at some of the genes involved, not all of them. And these tests factors outside of the scope of the test may also impact how antidepressant will help you. So even if you have the genetic test done, you may still need to try different antidepressants and different doses to find out what works best for you. So currently these tests are not recommended for the treatment of depression and the SSRI dosing.
Oh, so who says I don't need this test?
So actually the Centers for Disease Control and Prevention, they commissioned an independent group to evaluate the scientific evidence to see whether or not genetic testing is useful in selecting treatment for depression. And they actually found no conclusive evidence to indicate that the genetic testing improved health outcomes.
Oh, okay. Well, I do have another question. So you say that it might take several months before we find the right drug and the right dose, and I'll have to deal with the side effects. This is going to affect my life.
Absolutely. So while the test is not recommended, there are some implications of, dealing with the side effects of the drug. So you're also at elevated risk for SSRI overdose while you're going through the 6 month period of trying to figure out the right dose. So these can have social implications, which, can cause drowsiness, tremors, nausea, vomiting, seizures, and sometimes at the extreme coma. So, we want to just administer the SSRIs, and they should be approached with caution. And also, we want to think about with the test, there's a cost implication. So, if the insurance company is not covering the cost of the test, it could be very, costly to you and your family.
Yeah.
So, and we also want to think about the time that it takes to take the test and then start medication. So, by the time you take the test, you could probably be starting medications before you actually get the result back. So you might be on your way to finding the right dose before you actually get the results of the test back. So,
Okay.
while there is a test out there, we actually recommend working closely with your doctor, and it can be just as effective as taking the test, and we can figure out what works best for you and your body.
Oh, okay. Well, thanks, Ellen, for answering all my questions
Yeah,
today.
I enjoyed working with you.
Thanks.